This is JAPI, and welcome to JAPI Podcasts.
In partnership with Torrent Pharma, by the makers of Nebicard and Telsar Biso, where science meets care.
I'm Dr. Jayant Panda from SAV Medical College, Cuttack, and I welcome you all to the JAPI Podcast of the April 26 JAPI Volume 74, Issue 4. This issue of JAPI has some really interesting articles, including 15 original articles, 2 review articles, 1 point of view, and 1 pictorial CME. Let's discuss this in detail. The first original article is titled Thyroid Hormone Levels Even Within the Euthyroid Range and Associated with Lipid Levels by R.S. Sudarsini et al. This cross-sectional study evaluated the relationship between thyroid function and lipid profile in 100 euthyroid individuals. FT3 showed a positive correlation with HDL cholesterol and a negative correlation with total cholesterol. FT4 and the FT3-FT4 ratio were also positively associated with HDL levels. These associations were stronger in men and in those with TSH more than or equal to 3 micro-international units per ml. Overall, FT3 displayed a favorable impact on lipid parameter, particularly increasing HDL cholesterol. In page 14, we get the next article titled Perioperative Float Chemotherapy in Resectable Gastric Adenocarcinoma, a single-center retrospective observational study by the authors Hemasira Nati, Mrs. Gumdal, Deepak Kopaka, Sanjana Reddy et al. Gastric cancer is a major global cause of mortality, and perioperative float chemotherapy like 5-fluorouracil, leucovorin, oxaliplatin, and docetaxel is the standard treatment for resectable cases. This retrospective study from 2019 to 25 evaluated the feasibility, safety, and outcomes of float in a real-world tertiary care setting. About 64.4% of patients completed more than or equal to 4 neoadjuvant cycles, but only 24.4% underwent surgery, with no complete pathological responses. Severe adverse events occurred in 18.1% of patients, mainly cytopenias, and 45.4% were lost to follow-up before surgery. Although float was a relatively safe, low surgery rates and high attrition highlight challenges in treatment adherence and patient selection was seen. The next original article was on holistic health, an attempt to achieve holistic health by improving spiritual, emotional, and psychological well-being, a clinical trial using an Eastern spirituality-based intervention in Indian context by Anirban Pal et al. Spirituality well-being is a key component of holistic health alongside physical, emotional, and psychological aspects. This study evaluated the impact of a 6-week Eastern spirituality-based intervention in 140 participants, and the participants receiving the intervention showed significant improvement in spiritual well-being scores. Emotional, the stress, anxiety, and depression, and psychological well-being also improved with moderate effect sizes. The findings suggest spirituality-based interventions can enhance overall holistic health, though further research is needed. Let us move forward to page 24, where the next article is titled Acute Pancreatitis Beyond Gallstone and Alcohol by Ravi Shankar Bagepalli et al. This prospective observational study of 150 acute pancreatitis patients included a majority men at 72.9%. Chronic pancreatitis cases were excluded from the study. Alcohol was responsible for 36% and the biliary disease for 30%, which were the most common causes. Non-alcoholic and non-biliary cause included diabethic 14%, hypertriglyceridemia 4.67%, endoscopic retrograde cholangiopancreatography or ERCP related in 2%, infection related in 3%, the hyperparathyroidism in 2%, and the drug induced in 5.33%. Abdominal pain was the predominant presentation in 98.6%. The organ failure and the mortality were low in non-alcoholic and non-biliary cases. Despite lower mortality, early identification and management of these causes are important to reduce hospital stay. And we move on to page 32, see the next original article on comparison of Q-SOFA score and NEWS2 score in sepsis patients admitted in emergency department and ICU as prognostic markers of patient outcome by Kumar Anupam et al. Here the prospective study of 874 adult sepsis patients at a tertiary center in northern India between 24 to 25 was done and compared Q-SOFA and NEWS2 scores for predicting a 7-day, 28-day mortality and hospital stay. NEWS2 demonstrated higher sensitivity than Q-SOFA for both 7-day, a 63.1% versus 35.1%, and a 28-day mortality, a 64.1% versus 37.3% with similar specificity. NEWS2 is a more reliable bedside tool for early risk stratification and identifying high-risk sepsis patients. The next original article titled Effectiveness of Simulation Training on Students' Confidence and Competence in Performing Basic Life Support was published by Sushant Kumar Mishra et al. A quasi-experimental study involving 60 undergraduate medical students compared simulation-based and lecture-based training for basic life support or BLS, and students were assessed before and after training using OSCE-based competence scores and confidence questionnaires. The simulation group showed significantly higher post-training competence and confidence than the lecture group. Within group analysis also demonstrated significant improvement in the simulation cohort. Overall simulation-based training was more effective and supports its inclusion in medical curricula for BLS skill development. Next article was Factors Contributing to COVID-19 Mortality in Hospital and After Discharge, the results of an ambivalent cohort study from a tribal district of Kerala in India by Chandrasekharan Pariyar et al. This retrospective cohort study of 402 patients with moderate to severe COVID-19 in Wayanad, Kerala reported in hospital mortality rate of 17.7%, and the mortality risk increased with age, the multimorbidity, hypoxia, and abnormal laboratory markers including D-dimer, liver enzymes, renal parameters, hypertension, cancer, and neurological disorders were significantly associated with higher mortality, with a dose-response relationship seen with multiple comorbid independent predictors including age, hypoxia at admission, ICU admission, serum creatinine, and the SF, that's the SpO2 FiO2 ratio. Among survivors, 73% reported post-COVID symptoms, most commonly fatigue and breathlessness. The study emphasizes prioritizing high-risk patients and early management of comorbidity in resource-limited setting. Let us see the next article in page 43, a study on electrocardiography, echocardiography, and cardiac biomarkers in aluminum phosphate poisoning and their prognostic correlation by Harshvardhan Tiwari et al. Aluminum phosphide poisoning is a highly fatal emergency due to severe cardiotoxicity. This cross-sectional study of 100 patients evaluated clinical, ECG, echocardiographic, and biochemical prognostic markers. ECG abnormalities and reduced ejection fraction were significantly associated with mortality. Elevated cardiac biomarkers and severe acidosis were strong independent predictors of poor outcomes. Early recognition of high-risk features is crucial to guide intensive management and improve survival. The next article was titled Assessment of WHO Core Drug Use Indicators in a Government Teaching Hospital of Assam. Evidence from Prescription Audit Data by Levita Hazarika et al. This prospective study analyzed 700 OPD prescriptions from a government teaching hospital in Assam using WHO Core Drug Use Indicators. The average number of drugs per prescription was 3.6, indicating polypharmacy. Generic prescribing was low, 37%, and only 37% drugs were from the National List of Essential Medicine, that is NLEM, and the antibiotics were prescribed in 39.14% of encounters exceeding WHO recommendation, while injectables use was 6% was appropriate. Overall, this study highlights that only prescriptions involving injectable drugs were in accordance with WHO recommendation, while the other parameters exceeded the WHO recommended values. The next article was titled A Clinical Profile of Transverse Myelitis with Special Reference to Outcomes, a 5-year retrospective study by Himabindu Pendem et al. This retrospective study of 30 patients with transverse myelitis evaluated short and long-term outcomes. 63.3% patients had acute onset and 76.7% had longitudinal extensive transverse myelitis, with paraparesis in half of these patients. At discharge, 43.3% showed partial and 16.7% complete improvement. At follow-up, about 30% achieved the complete recovery, while 8.3% worsened and one case converted to multiple sclerosis. Early clinical improvement was associated with better long-term recovery, while acute LETM cases or the longitudinally extensive transverse myelitis cases had risk of multiple sclerosis conversion. In conclusion, acute onset longitudinally extensive transverse myelitis cases can potentially convert to multiple sclerosis. Patients who show early improvement, whether partial or complete, have higher chance of complete recovery at follow-up. Let us move to page 62, and the next article is titled Examination and Validation of Neutrophil Lymphocyte Ratio or NLR as a perioperative risk assessment biomarker in measure non-cardiac surgical patients, an observational cross-sectional study by Salini Nangalia et al. This observational cross-sectional study evaluated the role of neutrophil lymphocyte ratio, the NLR, as a preoperative risk marker. Elevated NLR was associated with factors such as age, heart failure, smoking, malignancy, and beta blocker use. NLR showed a significant correlation with established anesthesia risk indices, including ASA, PS, RCRI, ARI, SCAT, and Gupta's postoperative respiratory risk. Higher NLR reflected greater systemic illness, and perioperative risk was seen. A study suggested NLR as a simple and useful biomarker for preoperative risk stratification. Let's move to page 69, and the next study is titled Effects of Omega-3 Fatty Acid on Tobacco Craving in Tobacco Users, a single-blind randomized placebo-controlled study by Anjali Singh et al. This randomized study evaluated the effects of omega-3 polyunsaturated fatty acid, that is ALA, supplementation on tobacco use in 83 regular users. The participants received either omega-3 PUFA or placebo for 180 days. An omega-3 group showed a significant reduction in daily tobacco use, dependence, and craving, which is statistically significant, and omega-3 deficiency is linked to increased craving via impaired neurotransmission and oxidative stress. The study suggests omega-3 polyunsaturated fatty acid as a potential adjunct in tobacco cessation, though larger studies are needed. In page 75, the next article titled Risk of Tuberculosis with the Use of Inhaled Corticosteroid in Delhi and National Capital Region by Nalini Kuri et al. Here, this observational study assessed the association between inhaled corticosteroids use and tuberculosis risk in 97 COPD patients. Patients were categorized into TB, that's around 4, and non-TB, around 93. Groups after the prolonged inhaled corticosteroid use, that's more than 2 years, and no significant correlation was found between the inhaled corticosteroid use and development of TB. However, prior TB history was strong risk factor for the reactivation, which is statistically significant. P is less than 0.001, and the anemia was also noted in reactive TB cases, indicating possible underlying chronic diseases in COPD cases. In page 82, the next study is titled A Study Comparing Tuberculosis-Related Stigma in Healthcare Providers and Receivers by Mustan Sibir Abbas Ali et al. This study assessed the prevalence and pattern of tuberculosis-related stigma among the patients, healthcare workers, and family members in India. Stigma was highest among the healthcare workers, 11.78%, followed by the family members, 8.91%, and the patients, 6.05%. With significant variation across groups, patients mainly experienced stigma at home, while family members and the healthcare workers faced it in the community. The findings highlight that stigma is deeply rooted in societal perceptions and norms, and addressing stigma is essential to improve the TB diagnosis, treatment adherence, and overall disease control. In page 88, we get neck circumference, a screening tool for predicting metabolic syndrome in obese children by Srinivasan Thiagarajan et al. This cross-sectional study evaluated neck circumference as a screening tool in 211 overweight and obese children aged 5 to 13 years. Higher neck circumference was significantly associated with metabolic syndrome and with greater prevalence in the high neck circumference group. The neck circumference also correlated with the waist circumference and other metabolic risk factors. It serves as a simple, non-invasive marker for identifying insulin resistance and metabolic complications. The study suggests the neck circumference can be a practical alternative to BMI for early risk screening and children. In page 92, the two articles which are review articles, first one being on renal denervation therapy. The top title is The Modern Device-Based Renal Denervation Approach for the Management of Uncontrolled Hypertension by Arun Gopi et al. Uncontrolled hypertension can result from untreated high blood pressure or the inefficacy of established antihypertensive therapeutic regimens. Renal denervation is a non-pharmacological catheter-based intervention that achieves targeted renal sympathetic nerve ablation to modulate sympathetic activation. The RDN or renal denervation is suitable for those who with uncontrolled primary hypertension, resistant to therapy or intolerant to drugs, and who have a favorable renal artery anatomy. And the long-term data demonstrated renal denervation's efficacy in significantly reducing elevated blood pressure. The renal denervation procedure have shown a good safety profile and no significant difference in adverse events has been reported between the renal denervations treated and control group in most clinical trials. Thus, renal denervation offers an effective and safe approach for sustained blood pressure control. The second review article was on respiratory examination for postgraduate residents, the unrevealing exports questions and answers by Dr. Deependra Kumar Rai et al. The physical examination is pivotal for getting a clue about the disease and making a provisional diagnosis. The respiratory examination is considered to be one of the toughest systemic examination by undergraduates and postgraduates residents. No well-defined literature is available regarding the ideal method and interpretation of the respiratory examination findings. There are many questions asked by experts that are hardly found in the literature. This review included a total of 30 important questions and the best possible answers, including expert questions from top institute that are important for the respiratory examination and would help all students from the undergraduation, post-graduation to the specialty to excel in their practical examination. So with this, we end this podcast of JAPI of April 26, volume 74 and issue 4, and we thank you for listening to the JAPI podcasts.